So I've actually done some training programs that were targeted to faculty members just to sort of expose you to what it is to do commercialization and then what are some of the issues around that. So I was fortunate enough to be a member of the Summer Training Institute for mHealth that's through the Office of Behavioral and Social Science Research through NIH. So I did that as a 2-week course a few years ago. And then in addition, our research group has been involved in the SPRINT program, which is sponsored by the National Cancer Institute. So again, another program where they expose faculty members to sort of what are the steps and the other pieces that you need to do in order to move into commercialization. So if I'm thinking about this process today, now knowing what I know, and then giving myself some advice going into it, I think what I would have done to begin with is to really work with our technology transfer office up front to better understand what sorts of resources they have, but then also to have them help us network locally here at Rutgers with some of our investigators who are around the table, because we do have computer science, we do have a business school, we have a bunch of different resources here that I'm now in the process of being able to access. But I think at the beginning of this process, knowing who they were and when to be able to go to them would have been really, really helpful for us. So that was a growing pain that I would share. The other thing that I would also recommend is talking to other groups who have actually either developed something similar to what you are working on, or even if it's not your content area, if they're using the same sort of platform, starting to talk with them about what did you do? So there are people who already have funded STTRs and SBIRs. And so talking to them about how did you start to make these decisions? And early on, even as you're developing the interventions, there are some things that we probably would have done differently in terms of how we set up our intervention and how we're actually thinking of it and conceptualizing had we been thinking about an SBIR or an STTR up front. So my two major things would be talk to other folks who already have SBIRs and STTRs to get some of their lessons learned and hard knocks so you don't actually have to experience them yourselves. And then also go to, again, your local context and all of the groups that are around you. Better understand sort of what's going on in your local setting so that you can actually hit the ground running and not have to sort of circle back and circle around in order to get to where you want.